What's up, guys? So today is going to be a 5-month post-op SRS video. There's been a lot of stuff going on in my life and I've been so incredibly busy. I haven't even been able to put up a 3-month update video. My last update video, believe it or not, was filmed late July, early August. So it is now November 12th, so it's been a really long time, and I'm sorry. It's just my life has been busy. I've started a new job. I live in a new city. My new job requires me to work weird hours, so I'm always pretty much working. I work 6-7 days a week, but it's something that I love to do. It's my passion, and I've really enjoyed it. It's just I've had no real time to sit down and come up and edit videos and film videos and just do that stuff. It's just kind of, I've been so busy with starting my new job and making new friends and stuff like that. But I've had a little time off today, so I wanted to make an update video for you guys because I do think this series has helped other people and give them good insight on what it's like having SRS, especially a couple months after surgery. So today I'm going to be talking about different things like dilation, sensation, just my mental psyche, everything like that. So if you guys are interested in this video, definitely stay tuned. Alright, so as I mentioned, my last update video was my 6-week post-op follow-up at Dr. McGinn's office. And when I was there, I had some granulation, but they said basically everything looked well. However, in my last update video, I mentioned that I was still completely numb down there. Well, I am excited to say that I am no longer numb. Right after, or when I went there, they gave me a prescription for testosterone, and they mentioned that testosterone helps bring back feeling and gets kind of everything going a little quicker. So I'm on a low dose of testosterone where my testosterone levels are still like a cis female. And it was funny because like 2 weeks after I started my testosterone, I got my feeling like that. And it's not like you can just like reach down there and touch it. It's like, no, it is, I mentioned it before, it's like a hammer being nailed, or a nail being hammered right into your vagina. And I was sitting doing my makeup one morning at my parents' house, and the sensation hit me. And usually I've had those sensations before, but they only last for maybe like 1 or 2 seconds at most. No, this one like literally destroyed me, and it was so painful, and it lasted for like 30 seconds to a minute. I had to like grab the counter and just like sit there and control my breathing because it was so painful, and it was my nerves connecting. And then from that moment on, I started to have feeling in my clitoris. Granted, it's not as much feeling as I still anticipated, but I'm still getting those shooting pains, so I still think I'm getting feeling, and it's gradually getting more and more and more every day. Around like my labia and my clitoral hood area, I'm still pretty numb. Like if I rub my finger on it, I still don't feel it. Like if you rub your finger here, you can feel it like pretty well. I still like, it's not even close to this feeling right here. And so that's kind of a bummer, but it's coming. I would say it's been getting better over these last 5 months, but it's still not quite where I want it to be, and I'm not satisfied with it. And I know that kind of leads into like orgasms and playing with myself. Just kind of want to hold on that for a little bit because I do want to make a video specifically dedicated to that, and hopefully I'll have that video to you guys in the near future. But I just wanted to give you guys an update that yes, I do have feeling down there, but it's not as great as I wanted it to be. So I mentioned I am at my new job, and one of my goals was to actually be more out about being trans and kind of find this balance, because when I lived in Colorado, I no longer live in Colorado, I was very stealth and I didn't tell anyone I was trans, and to be honest, it was really hard on me. It was very difficult, and because I had a lot of trans issues and I felt like I was always hiding. Here, at my new job, within the first 2 times of hanging out with some of my friend group now, I came out to them and they're totally accepting, and it's been really nice because, you know, I have things going on, especially with post-surgery stuff that is really difficult, and I don't have time to see a therapist, but it's nice because I can actually talk to them about it, and they're completely open and they're completely supportive, and it's really nice to have that and have that community and being able to be open with them. Now, granted, I would say at my job, they work with me. I should mention that, but like my boss still doesn't know. And there's a few other people that know, but to be honest, I think I'm at a good balance. I think I'd like a little bit some more people to know, but that will come with time. I know it will. But it's a nice balance right now of people who know and people who don't know, and it's just like, it's good. I think I'm very happy, and I think it's very important to me for my life to be okay with being trans, and really them being okay with me has accepted me, allowed me to accept myself even more for being trans, because I mentioned I don't enjoy it, but it's been really nice, and they treat me just like another woman, and it's been very nice. So now, kind of back to surgery stuff. I've still had swelling over these last 5 months, and especially recently. So my job is very active, or I'm always sitting, and when I'm always active or always sitting, I tend to swell more and more every day. And then I have to go home and lay down, and when I lay down, the swelling does go down. However, this last week, my swelling has been really bad, and it's been really painful, honestly. It's been really painful around like my clitoris area. It's been really painful, my mom's area, and it's swelling, and I can see it. I come home, it's huge, and it's weird. Like, so your vagina, let's do it this way, it's like this, right? And when it swells, this top part where my like clitoris is, it starts to sink down and it gets swollen, and it kind of just, it looks like that, and it's just like super painful, and it hurts. And I mean, I've been having to come home, and in the middle of the day, usually I come home in the middle of the day to get my second dilation in, but it hurts so bad that I have to lay down and I have to elevate it and try to get the swelling to go down a little bit, because throughout my day, it's so painful, and it really sucks. It hurts to sit. It just really hurts to do anything, and I really didn't have that before. Like, obviously I had the swelling, but now the pain is here, and it really hurts. So that has been one thing that has really sucked, especially this last week and a half. Along with pain on the outside and swelling and dealing with that, I mentioned in my last video, I got treated for granulation. And that's when they stick like matchsticks in, and basically when you have a wound, sometimes the wound will like crystallize, and they'll have hard parts in your vagina, and the match will take care of that, so it's all soft tissue and it's not like sandpapery and stuff like that. When I was there, Brianna put me on like this hydrocortisone regimen, and what that does, it helps loosen up the skin, because I am pretty tight still, and by loosening up the skin, or you need to insert the hydrocortisone into your vagina to make sure, and rub it around, and usually you can use your finger, but they also gave me this pump right here, so it goes in and you pump it in, and then you spread it around. Well, I used this pump right after they did that treatment on me, and it cut me on the inside, and because of that cut, it started bleeding, and it wasn't very good. And since then, that cut has healed again, but I have even more granulation tissue than I did before. And my granulation tissue really hurts. So I'm dealing with granulation tissue that is very painful, especially when I dilate. I mean, dilation is not fun right now because, or hasn't been fun, or it's just been a complete inconvenience because it's been so painful. And then on top of that, I have my swelling going on. And so that's been extremely painful. And it's just, I mean, I deal with it as soon as I dilate, and I dilate for 20-30 minutes. After about the first 5-7 minutes, it's not as painful because I think I pushed some of that blood out of there, and it just kind of, my mind gets used to the pain. But it is so painful for the first 7 minutes, and it feels like it's still getting tighter and tighter, and I have to really, before I could just put the dilator right on in and I'm at full depth, then I can just sit there and for my 20 minutes. But now it's so painful. I have to gradually work it like this far at a time, and it takes me 7-8 minutes just to get the full depth in. And usually on my first dilator, which is my purple dilator, the little one, I can't even get my full depth, and it really hurts. And then usually by that time, my, I guess, vagina is warmed up, and I can use my dilator number 2, the blue one, and I can get my full depth with that one. But it has been extremely painful. So my satisfaction with the surgery and my body and everything like that. So I will admit my dysphoria is completely gone, which is amazing, and I don't really have much dysphoria. However, my mind still isn't used to the fact that I have a vagina. And there is a lot of disconnect between my mind and my vagina, and I don't have dysphoria because my penis isn't there, but on the other hand, my mind isn't completely, like I said, connected, so I'm kind of dissatisfied as of right now. I think once the pain goes away and once the swelling goes down and it's kind of just like how it's supposed to be, I think it's going to be a lot better. But I think why my mind is at such a disconnect with it right now is because it doesn't, when my mind thinks of my vagina, it doesn't think of good things. It thinks of pain, it thinks of swelling, it thinks of dilating and taking up time, and it's been an inconvenience. And so I really think my mind's having trouble making a connection with my vagina because of all those things, and it hasn't represented anything good yet. And so that's been really tough. Like I mentioned, my dysphoria is gone, and that's been really nice. It's been really nice just to wear leggings and go out in public and not have that idea constantly in the back of my mind that I have a penis and all that stuff. Like, that stuff is just, it's been gone. And so that's really nice. But it's, on the other hand, I'm very unsatisfied. And I guess Dr. McGinn kind of warned me about this, and she said, you know, for a long time you're not going to feel like sexy, I guess. And that's the way, the term she put it, and I wouldn't even put it as like sexy, but it's just, she goes, you're not going to be satisfied for a while. And to be honest, I haven't really been satisfied because it's only been negative things. Now, saying that, my surgery 6-month post-op visit in New Hope is coming up in a month. So I really think once I go back there in a month, I'm going to get my granulation taken care of, and hopefully that will just reduce some of the pain. And then I know that my swelling and everything, that's just a time factor, and everyone heals differently. And I know that usually your swelling isn't completely down until 1 year. So I know that's going to take some time, and I think eventually I will be more satisfied with everything because I think it's going to be less painful. I mean, I'm sitting right now in pain, and that kind of sucks. So, but yeah, guys, so that was my video. I hope you guys enjoyed. If you have any questions or anything like that, please let me know, and I will see you next time. Bye.